I'm Dr. Mark Epstein, a board-certified plastic surgeon practicing in Stony Brook, Long Island, New York. Today I'd like to talk about the differences between saline and silicone gel implants. Many of my patients ask me, what's the difference between the two types of implants? Well, there are some differences and there are some similarities. This is a saline implant. Saline implants are deflated when they're implanted and then filled once they're within the patient. A saline implant has a silicone shell which is biologically inert. In other words, it doesn't react with the body. This particular one has a textured surface, but they also come with a smooth surface. This is a silicone gel implant. Silicone gel implants are all pre-filled at the factory. They require a slightly larger incision to place than a saline implant. Saline implants are rolled up like a cigar and placed into the wound in the breast. There is a valve which is used for the purpose of filling the implant. A fill tube is inserted into the implant and then connected to the saline. A closed system is used to help prevent infection, so all the saline comes from an intravenous saline bag into the syringe and then ultimately into the tubing. This implant is a 350 cc implant. This happens to be a teardrop-shaped implant. To fill it, once it's in the body, add saline. There's a valve that prevents the saline from coming out. One of the nice things about a saline implant is you do have the ability to add a little extra saline to help take care of some of the rippling and wrinkling, but also if there's a slight asymmetry in the breast, you can make up for the difference in volume to a small degree with some extra saline. Silicone gel implants are pre-filled and don't give you that option. Now the implant is inflated to the recommended 350 cc's of saline. But you can inflate this one with an additional 20 cc's if you desire to help take care of some of the wrinkles. So I've now put in 370. Once you're happy with both implants, the volumes look good, the placement looks good, you simply pull the implant out, place your finger over the valve seal to seat it, and your implant is filled. You'll notice these implants have a fair amount of rippling and wrinkling. In fact, saline implants have approximately 14 times the amount of rippling and wrinkling than a silicone gel implant has. Silicone gel implants also have a much more natural feel. They change shape and they're softer than the saline implants, which tend to be a bit more firm. Silicone gel implants are FDA approved for women 22 years of age and older. For women under that age, generally we recommend saline implants. As I said, this is a teardrop shape. Teardrop-shaped implants have more forward projection at the bottom of the implant than they do in the center portion. Round implants, such as the silicone gel implant, have more of their fill and projection at the center. However, saline implants and silicone gel implants, in my experience, behave differently. I find that there is a much more natural result when I use teardrop-shaped or anatomical-shaped implants of saline than when I use the round saline. And when I review my own photographs, and if you look on my website, I do have examples of both, and I think you'll agree that the teardrop or anatomical implants do tend to look more natural. However, with the gel implants, I'm seeing very favorable shape in the breast, and I'm finding results that I think compare very nicely in shape to the saline anatomical implants, even though these implants are round. Furthermore, you don't have a valve, which is at risk for leakage, and these implants do feel a little bit more natural. One of the advantages, however, of a saline implant is if for any reason the device fails, if it develops a crack or a leak at the valve, the breast will deflate in approximately 2 days, and there'll be no doubt that there's a problem with the implant and you have it replaced. Silicone gel implants, should they leak or develop a hole, if any silicone comes out, you won't know it because the silicone is not absorbed by the body as it's biologically inert. Furthermore, the scar tissue capsule, which surrounds both types of implants, will contain the gel. The FDA currently recommends women obtaining silicone gel implants to get an MRI 3 years later and then every 2 years later to monitor for implant rupture. However, the decision to get those MRIs is a personal decision and may or may not be covered by insurance. However, overall, both devices have advantages and disadvantages, although I believe the silicone gel implant does tend to give a more natural feel to the breast than the saline. The silicone gel implant also requires a slightly bigger incision, approximately 1 centimeter longer than I need for the saline implant. However, that doesn't seem to be an issue for my patients. It's my belief that it's very important for a plastic surgeon's website to have information for patients. Our website, www.epsteinplasticsurgery.com, has an extensive photo gallery with many before and after examples. The reason I believe it's important to show many examples is because my goal is to make it so that a woman can go on the website and find someone who appears somewhat similar to her and see what was done and how that person looks. It's not a guarantee of how this particular patient viewing the site will look, but it does give some useful information. Also, there is an extensive frequently asked questions section for breast augmentation that reviews many of the aspects of breast augmentation, including the risks, the benefits, the different surgical approaches, and answers many questions that my patients have. I think it's very worthwhile to review this section prior to coming to a consultation to make the consultation a much more enriching experience.